there are different levels of NICUs, and it's a little confusing because it's opposite of, for example, a emergency room, like a trauma center. At a hospital, you have a level 1 trauma center, a level 1 emergency center, which is the highest level. NICU is opposite. Level 4 is the best NICU, or rather more equipped NICU, and level 1 is the least equipped or least complex. So if your baby is in a level 1 NICU or your hospital has a level 1 NICU, that technically is just a nursery. So things for bathing your baby, or if they need some help with feeding, but nothing serious. Now, if your baby's having a little bit more difficulty, then they might need a level 2 NICU, which is also called a special care nursery. And that can help babies that are born after 32 weeks. Sometimes they need some extra help with feeding or nippling. Sometimes they are having some blood sugar issues that they just need monitored. Now, if your baby is a little bit more complex, they might need a level 3 NICU. Typically, those NICUs handle babies born before 32 weeks. What they can help with is things also like feeding, but they could also put your baby on a feeding pump, or if they need gavage feedings, or also they could have your baby in an incubator, for example, if they were a preemie or they were a small birth weight. A level 3 NICU can also help with respiratory support. So if your baby needs something called CPAP, which is like a mask, or if they need a nasal cannula to help them breathe, or even if they're intubated, they have a tube down their throat, that's something that a level 3 NICU can do. Babies with the most serious conditions typically will go to a level 4 NICU, which is the highest level NICU, and they can provide extra support they need, whether that be oxygen, or sometimes they need cooling if they have something called hypoxic ischemic encephalopathy, or HIE. So they need cooling for their brain. That's something that a level 4 NICU can provide. It's the highest level of care around the clock. And also they have pediatric specialists 24/7 that can help your baby with whatever they need. Sometimes if the hospital you deliver at, if they do not have a higher level NICU, such as a level 3 or level 4 NICU, they'll transport your baby to a higher level. So sometimes they can do that I know around here we have something called Panda 1, which is a equipped ambulance that has all the things necessary to transfer your baby, or sometimes they'll even be airlifted by a helicopter to a higher level NICU. So they'll do whatever they need, hopefully, to get your baby the support and help that they need.